Bismillahirrahmanirrahim. Assalamu alaikum. I am Samia Fatma. Our today's topic is cystic fibrosis. Now, what is cystic fibrosis? Cystic fibrosis is an autosomal recessive inherited disorder of the secretory gland which makes mucus and sweats. Cystic fibrosis is involved in the production of mucus that is much thicker and more stickier than the usual. So this mucus is difficult to cough out of the lung and make breathing difficult and lead towards the severe lung infections. Now, next part and the most important part of this presentation is its pathophysiology. Cystic fibrosis is occurred due to the mutation in the CFTR protein, cystic fibrosis transmembrane conductance regulator protein. This defect caused the impaired transport of chlorine, sodium and bicarbonate which result in production of thick viscous secretion in the lungs, pancreas, liver, intestines, reproductive tract, and it leads to increased salt content in the sweat gland secretions, as you can see in the picture. Now, there are some organs which is affected due to the cystic fibrosis. Most common cause of the death is respiratory failure, in which the lung is mainly involved. Second most common cause of death is the right heart failure. Then the different abdominal organs, for example pancreas, liver, gallbladder, intestine, reproductive organ and also sweat and salivary glands are affected due to cystic fibrosis. Now, pancreatic disease which involved in the cystic fibrosis are pancreatic insufficiency, pancreatitis, and cystic fibrosis related diabetes. Pancreatic insufficiency is pancreas failed to make adequate enzyme to digest food in the small intestine, which leads to malabsorption of the fat. Such patient may present with a deficiency of the fat soluble vitamins, vitamin A, vitamin D, and vitamin K. Pancreatitis. Pancreatitis is abnormal pancreatic secretion, bile salt secretion. Cystic fibrosis related diabetes, impaired function of the endocrine pancreas leads to development of the cystic fibrosis related diabetes. Now secondly, bone diseases. इंक्रीज करते हैं बोन फ्रैक्चर को, लो बोन डेंसिटी एंड केपोसिस. रिस्क contributed in the bone diseases are the chronic corticosteroid use, malabsorption of the calcium, vitamin D, vitamin K and magnesium. Main reason of the bone disease in this case is malabsorption of the vitamins and different minerals. So that's why bones are weaker. Now here is the medical management of cystic fibrosis. Avacaftor is oral drug which is first line therapy, anti-inflammatory, antibiotic, systemic and inhaled steroids, pancreatic enzyme replacement therapy, PERT, chest and physical therapy is included. Now medical nutrition therapy MNT. Cystic fibrosis patient should have nutritional assessment at regular interval of 3 months. Children with the cystic fibrosis should be monitored for parathyroid levels, 25 hydroxyvitamin level, serum calcium and phosphate. Now what is its energy needs or energy requirement? Energy needs depend on the cystic fibrosis mutation, patient age, current state of the health. Energy dense diet is more important. Hope we can achieve the energy dense diet or energy needs or energy requirement of this patient. High glycemic index carbohydrate can be a problem because high glycemic diet can promote impaired glucose intolerance CFRD by exceeding the capability of insulin production in the cystic fibrosis. Now protein is important for preventing the muscle loss. All the protein sources are mentioned as beef, chicken, egg, fish and soy. Zinc food sources are kidney beans, beef, spinach, liver, egg and seafood, and it is important for staving of infection. Calcium is important because it helps to reduce his risk of osteoporosis and a concern for patient with the cystic fibrosis. Its food sources are calcium based dairy products such as high fat yogurt, whole milk, high fat cheese, etc. Now fiber, which is help to reduce the risk of intestinal blockages. Many high fiber breakfast cereals are also high in the protein, which is best source for fiber and protein. Now iron. Iron help to fight off the infections and produce oxygen carrying red blood cells, and its food sources are liver, tuna, lamb, seafood, egg, beef and turkey. Now salt. People with the cystic fibrosis have saltier sweats which may cause the electrolyte imbalance and dehydration. Salty snack, pickles and sports drinks are can be replaced the salt you lose while sweating. You can also cook vegetables in the chicken broth instead of water. Supplementation of sodium chlorides are important. Next is antioxidant. Fruit and vegetables are the good source of the antioxidant most important for fighting of bacterial infections. Fat soluble vitamins are also very important. Vitamin A, vitamin D, vitamin E and vitamin K lead to overcome the deficiencies of these vitamins. Thank you.